We've got that mommy magic. The Mother Show on Magic 89.9.
Welcome back to the Mother Show on Magic 89.9. My name is Riki. In just a few minutes, we'll be ushering Doc Faith Alcazaren. And we also have, of course, Ria Campos-Lopez, who is a positive parenting specialist. I know. We're going to talk all about breastfeeding today. Pahabol, sort of a pahabol.
Yeah, since it's end of the month and it's breastfeeding month.
Yes.
So it's just perfect.
It is just perfect. Plus, one of us on the show is still breastfeeding.
Yeah.
I just stopped mine. So I just stopped my journey.
We can talk about weaning as well.
Yes, because that is actually the email that we had to kick off this episode. We want to thank S for sending it in. I'm going to read the entire email in a bit.
You know, I have a lot of friends that have trouble weaning. Because they try and then it fails and then they give in. So it's a whole cycle of trying to wean.
It is a whole cycle of trying to wean, and it could be, it can take months.
Yeah.
And for some, it can take days, months. So it's really different.
And then sometimes it's all of a sudden na biglang ayaw na niya.
Yeah, sometimes it's baby-led. Sometimes it's mommy-led. But, we're going to talk all about that today. So again, if you have any questions, just keep sending them in. You can talk to us as well. It's 631-0899. So we're going to introduce them now. First up, we have a pediatrician. She's also a breastfeeding advocate. She's a mom of 2. We have Dr. Faith Alcazaren on the show.
Hello, good morning.
Hi, welcome. We also have, she's a sleep consultant. I've heard her name before in all of these mommy groups. She's also a positive parenting specialist. Ria Campos-Lopez is here.
Hi, good morning, everyone.
There you go. So they're with us today. Also with them, we have a mental health advocate and professional yoga therapist, Bea Gomez. Bea's here as well. She's gonna facilitate, sort of watch over them.
I love it how we have so many professionals
I
today.
know.
So any questions
should watch
about
our words.
motherhood,
diba?
you guys should just call in now and ask it, right?
This would be the best time. It's 9:30 on the clock, so here we go. We have an email coming in from S. So she says she's been mixed feeding for 1 year and 7 months. I'm guessing her baby is the same age. Her backstory is she couldn't breastfeed exclusively because she didn't produce enough milk for her little girl, and she has inverted nipples. And when I gave birth to her until her 16th day, we tried breastfeeding, but she was not growing. Okay. And that's when the doctor advised to give her formula, supplementary milk. She breastfeeds on me, though, and if she's still hungry, we give her formula. I'm okay with it. I finally accepted that it's okay if she doesn't exclusively breastfeed. And everybody knows if you're a mom and that happens to you, that's a tough hurdle to get over, right? Yeah. The mere fact that you can't produce milk. So here's her dilemma. Lately, her left nipple started hurting, and she thinks her kid is biting it, but on the right, there's nothing. So it's just the left. She showed it to her OB, and she said that there's no laceration. But when she sent this email, she said that morning she noticed that it was bleeding after she nursed, and she put some breast milk on it because everybody knows that's like the best remedy for everything, right? Oh, sore eyes? Just put some breast milk on it.
Everything?
Everything,
Just breast milk.
yeah. And her OB advised her to wean already because the baby has been biting.
Okay.
So she goes, what should I do? Should I stop altogether? How do we start the weaning process? Maybe it's because of her underbite. So that's why she sent in that email. And, I was hoping maybe that's one of the first questions that we can answer. So yeah, it's 9:32. Thank you so much, S, for sending in that email. We will reply with some shopping credits from Kiduzi.
Yeah, so all you have to do, by the way, if you have any, some people, hesitate calling because they don't want to
reveal their name.
Who they are.
Mm-hmm.
So you guys can email us. We can just keep it private.
Yeah.
I mean, as sensitive or as secret as you want to be. Diba?
It's fine. We won't reveal your name. We won't reveal your name. So anyway, we kick off with that email, and I wanted to start with Doc Faith.
Yeah.
Is it advisable that she wean because the baby starts biting? Because, sooner or later, those babies are going to have teeth, right? And they won't know what to do with them. So the first thing that they're going to try to experiment on are,
She has a toddler already, right?
Yes. Nearing 2, I think.
All right. So after the first year of life, she really doesn't... Extended breastfeeding is recommended. But if she has been bothered by the biting and the bleeding... At this stage, the child has to be, getting all his nutrition from food.
After 1.
So extended breastfeeding is okay. The baby still gets some nutrition from the milk, but majority is coming from the food. So weaning is okay. She shouldn't feel bad about it.
Okay.
And it also depends on how much she wants to do extended breastfeeding still.
Yeah.
No? So if she's getting all stressed about the bleeding nipples and she's lacking sleep already and all those factors, it's okay to wean.
Okay.
Because right now her baby's not depending on her milk anymore for nutrition.
I see.
For the entire nutrition, because the milk cannot sustain the body anymore.
So no pressure na to.
Yeah.
No
at this point.
pressure. Yeah.
Kasi, diba, sometimes, when I have a friend also, her kid turned 1.
Yeah.
But then, the kid doesn't eat a lot of solids. So it's still, like, her milk pa din.
Her milk.
Yeah. Like majority, like, if you compare it,
Alright.
like, more milk than solid food.
Well, she has to, before she transitions to solid food, she has to learn to wean properly.
How do you do that, though?
Yeah.
Diba? How do you train them to eat more solid?
I have a problem with
diba?
that. I'm going to tell you straight up. Yeah, I have been struggling
Versus
with
more
that.
milk.
Well, that's why there's a complementary feeding stage starting
Okay.
at 6 months during infancy. And that's the time when we start training the child to get used to solids. Yeah, at 6 months of age, you start feeding them different kinds of food with different textures. Yeah, you introduce food to them.
Yeah.
You teach them how to eat.
Yeah.
You bring them to the table, eat with the family, so
Yeah.
they learn that this is our culture. This is how we do it. We just
It's
you don't
life.
just
Yeah.
this is life.
It's actually fun
drink
because
it.
I'm in that stage now.
That's right. You are.
Yeah.
See, Amelia is how old
She's
now?
7 months. Yeah.
Yeah, you really start early during infancy. And there are a lot of good habits that you can form starting infancy. And weaning starts at 6 months. So at 6 months of age, you already feed your baby with the family, so she sees this is how it's done.
Yeah.
And then carefully introduce different textures so that the jaw muscles will be trained to chew.
Okay.
So if the child is so used to pureed foods,
Yes.
and all she knows is to take in
Swallow.
food and swallow, she won't get used to the texture of real food. So she needs to learn that, okay, this is what chunky feels like.
Yeah.
Yeah.
This is what rough or crunchy feels like. Yeah.
So, in your opinion, what's better? Because there's baby-led weaning, and there's also pureed food.
Yeah.
What would you go?
All right. So
For?
baby-led weaning really doesn't have enough robust evidence to say that this is a better feeding method. But
okay.
what the experts really recommend is, which I also recommend to my patients, is responsive feeding. So
Define responsive.
Yeah,
Well,
and also we should define baby-led weaning.
Yeah,
to
and
people
weaning
who
in
don't
general.
know. Yeah,
that's the problem with baby-led
Diba?
weaning. There's no definite definition.
Because for me, what I think is just put food on
Yes.
on the table and
Yeah,
let
drumstick.
them. Yeah, and bahala na sila, diba?
Yeah.
Put beans and then they will
Yeah.
eat it. No, but it doesn't. For some moms, they do that. Like they put like an entire piece of drumstick
Oh my god.
on the plate, and they let the baby munch on it. No? But of course, as a pediatrician, there are also concerns of choking.
Yeah.
Because not all babies have developed that synchrony between chewing and swallowing. No, it's still developmental. The mom has to be trained to see if the baby is prepared for it. If your baby's not yet prepared for it, and you're shifting her from entirely pureed to a drumstick, then your baby might, just gag and
That's right.
choke on the piece of chicken.
That's right.
No? Although I keep telling my patients, don't get scared to feed. No, there are only a few choking hazards.
I
actually.
know. No, because the first time when they gag pala,
Yeah.
you're like, oh, what's happening?
Oh, yeah,
You
yeah.
get so scared right away.
Yeah.
Gagging is a protective reflex.
Yeah.
So that's how they protect the airway, and it's good that they gag.
Yeah.
But the choking hazards are only peanuts, whole grapes. So you have to those items that can get lodged in the airway as big as a peanut, like green peas.
Peanuts.
Yeah, because it's hard to to pull it out once it gets stuck in the airway.
I get it.
Otherwise, if they gag on something, it means they're trying to protect the airway. Don't just put water and make them swallow it.
Or make them gulat, diba? Because that's sometimes
don't panic.
Yes.
Yeah, don't panic. Don't panic. Like, just wait and then she will spit it out.
That's right.
Yeah.
It's 9:38. In case you're just listening, we have that's the voice of Dr. Faith Alcazaren. She's a pediatrician, a breastfeeding advocate. We're talking all about weaning, breastfeeding as well, what to give them when they're this age.
Yeah.
So if you have any questions, again, all you have to do is call us up 631-0899, or you can reach us online. It's at The Mother Show PH. Dr. Faith, how many kids do you have?
I have 2.
You have 2?
Yeah.
Okay. How old are they?
I have a 7-year-old daughter and a 3-year-old son.
Wow, 7 and 3. So how was your breastfeeding journey like?
Well, the first one was my first experiment.
Okay.
So
everybody has an
first one
experiment.
is always right. She's my first experiment. I was able to breastfeed for only 2 months.
Okay.
And formula fed thereafter.
How
So
come?
that was I had upon delivery, I had a severe infection.
Okay.
And my CS scar opened up.
Oh,
Because of that infection, they had to give me really strong antibiotics for it
Wow,
for 21
okay.
days.
Okay.
So my neonatologist told me then to pump and dump. And I wasn't very effective in pumping. Even if
Okay.
I was a pediatrician in training then, and I thought I knew
You
all
knew,
of it.
yeah.
I was attending lactation management courses. I thought I knew everything.
No.
But no. So my first experiment was a failure. I cried with the first scoop of milk that I had to give her. So there was mom guilt, no?
Yeah.
And eventually I started thinking the circumstances were not conducive for really stocking up on milk. The milk code wasn't in place yet. So we had a call room with a mixed gender call room. I had all my gadgets. I had a double electric pump. I had everything. I bought everything actually. But every time I get to sit down and attach all the horns, they would call me in the ward. So
Oh my gosh.
That is
so yeah.
hard.
That's
What
hard.
choice do I make?
Yeah, kasi it's hard to set up, diba? And I had like the thing, the bra thing that,
bandeau?
the bando.
The bando.
stick.
Yeah. I actually want those.
In fairness, so
It
you
works
can do
talaga.
anything.
Yeah. I thought I could do anything. But
Duty
you know,
calls, diba?
I can't see a patient with the pump, the horns on my chest, right?
Yeah, I don't think that would be.
Yes,
Yeah.
especially in PGH, in that ward.
Yeah.
So eventually, because that was my circumstance, the milk really did not. I really did not produce enough milk, and the pumping thing wasn't my best. You know, I wasn't able to pump effectively, and I thought I knew what I was doing.
Yeah, right. So if you're a mom listening at home, this happened to a pediatrician.
Yes.
It can
I
happen
think
to anyone.
that's very comforting to know
I know.
that it happened to you.
That you can take all the lactation classes that you can,
Correct.
but still you can
When
get
it's
hit.
there.
Yeah,
Correct.
yeah. Wow. So your second one,
My
your boy.
second one, I was determined to breastfeed.
Okay.
Yeah, but I wasn't successful in pumping again because he doesn't want to take the milk from a bottle.
The bottle.
Yeah, so I had to cup feed him, and eventually I decided I'll just bring you to the clinic.
I have a question. When can you introduce cup feeding? At what age?
Oh, even
what
newborns can be cup fed.
Really?
Yeah. Even premature babies can be cup fed. So you can cup feed at any time or at any age, but you have to be trained for it. Yeah. So if you want to get a lactation counselor to teach you and the caregivers, all of them should learn. So there was a time I bought this silicone cup feeder because I drive, the yaya is at the back. And since he doesn't want the nipple, she has to cup feed.
That's art. I mean, you're driving and you're cup feeding the newborn.
Yes.
No shaky hands.
Di pwede yan.
Good thing there's traffic.
Yeah.
Good thing
buti
there's
na
traffic.
lang.
And then
Thank
when
God for
he really
traffic.
cries and asks for mommy, then I have to
Pull over.
Yeah, pull over, stop, and breastfeed. So that was my life for 6 months. I had to sustain for 6 months.
Nice.
And then 6 months onward, I decide I'll feed you. I still breastfeed you, but I cannot bring you to the clinic anymore. Might get sick. Yeah.
Oo, delikado yun, no? Bringing a newborn
But he never
around.
got sick. Never got sick. Yeah.
Because of the breastfeeding, you think?
Yes,
Probably.
I think so. And a lot of my patients, I always counsel to breastfeed. So a lot of them are also breastfeeding. None of them really get seriously sick.
That's one of the beauties of breastfeeding, I think.
Yeah.
That even though the mom is sick, you're
You can
suffering
still
from like a
breastfeed.
flu.
Correct,
Yeah.
correct.
You breastfeed and your baby will not get sick.
So when it comes to like, so you were saying, even if you're sick, you can breastfeed. How about when it comes to like medications? Kunyari, if you're in antibiotics.
Yeah.
Ayun.
So medications are really not a contraindication. Not a lot. In fact, there are a lot of medications that are compatible with breastfeeding. And this is a tip. You can download lactmed.com.
LACT.
Yeah, there's an app for it also. You can put it on your iPhone. And you can search for the drug name. And you will find there all the summary of usage, the effect on breastfeeding, the effect on the baby who's breastfeeding, and the effect on your breast milk. No, so so there are very few actually.
Wow.
But if you're taking antibiotics and it might cause GI symptoms, gastrointestinal upset, in a few, it would be good to breastfeed before you take the antibiotic.
So pwede yun.
Yeah, pwede. It's really not contraindicated. Unless you're taking something radioactive.
Yun na yun.
Yeah. Or if you're taking illicit drugs, that's a contraindication.
Yeah.
Speaking of, no.
Question for a friend. It's 9:45. Thank you very much, Dr. Faith. We also have with us, of course, Ria Campos-Lopez. Hi, Ria.
Hi, good morning, everyone.
Welcome to the show. She,
Thank
like
you.
Andi, also has a pump bag with her today.
Yes.
Ria has. How old is your baby?
So I have two boys. I have
Two
a
boys.
3-year-old and a 14-month-old.
Oh, 14 months. Just
So how
turned
was it for your kids when it came to breastfeeding? Did it come easy for
Well,
you?
thankfully it was an easy experience, but I also started out with the thought that I'm just gonna try this as long as I can.
Yeah.
Because I wasn't sure what was gonna happen. And thankfully it worked. The difference that I had with Faith was I had to go back to the office. So I had no choice but to love my pump and get used to it.
It's so hard
Yeah.
to love the pump.
I know, so I had to become one with it. So I was studying so I was studying Faith. I just ended up pumping everywhere. So it's really just a regular pump schedule every 4 hours, right? Wherever you are, in the car, in the office, in a restaurant, in a meeting. So then I was able to successfully feed my first boy up until I got pregnant again. And sorry, I won't go into that, but I know there's different opinions of breastfeeding while pregnant or not. But he was over 1. So as Dr. Faith said, it was really time to give my son more solid. So I decided to stop to focus on my pregnancy. And now with my second son, I've just been going. Same.
And going.
Yeah. So it's been a good journey.
Okay.
Yeah.
You know what? We got a message from somebody via direct message on Instagram. It's at the Mother Show PH, and her name is Mia Ramos. So she goes, does one really need to pump to keep up with demand for her baby? Because, like, will the milk run out even if the baby latches directly most of the time?
Do I really
need to pump? Because
It's
she
such
doesn't
a
like
hassle.
it.
It's an interruption every 4 hours,
Yeah.
right?
Oh, the question is she collecting milk? And what is her situation right now? Is she staying at home? Is she a stay-at-home mom, or does she work outside?
That's true. Well, she
Yeah.
didn't mention, but I will message her.
But there are some women, they want to collect milk because it's
How
their
do you do
ticket
that?
to freedom.
Yes.
Again.
My milk
it's their
supply is
ticket to
down in the
freedom.
refrigerator. So I don't have that right time to pump because it's always like ubos na.
Yeah.
So how do I start again, like collecting milk
Producing.
while she's feeding at the same time? Do I increase like the pumping session? Do I do it
Yeah.
in the morning because there's more milk in the morning?
Yeah, so the body responds to demand. No? So if there's more demand, you breastfeed more frequently and you pump more frequently at a fixed time of the day.
fixed
like
time.
4 a.m. every day. Just make it a routine, no? Set your alarm, no? And then your body will produce the same amount of milk every time you pump at that time. It's body training. You have to train your body to respond to the demand.
Parang you have to trick it into
Yeah.
thinking
it's
that
a
the
baby
baby is
feeding.
there.
That's
Yes.
true.
Draining your boob of milk. How funny, no? The human body. It's so fascinating. So if you have any questions, like that one again, it's at the Mother Show PH. So Doc Ria, how did you wean your first? Sorry, Doc Ria, you're not a doctor. Ria, how did you wean your first
Yes.
while you were pregnant?
Okay, well, that one, I sort of just stopped cold turkey. And I didn't know better. But again, I had to balance that fact. Like, did I want to continue breastfeeding while pregnant? And my OB was supportive. But she also said, you're a little older. We don't want to have any contractions because breastfeeding can cause contractions.
Yeah.
So you really just weigh the options. So she was saying, because my son was healthy enough, it's okay. Maybe you should stop.
Yeah, just feed.
Yeah, and feed him regular food.
Yeah.
So I just did it cold turkey. I just stopped.
Paano stop? He wasn't like clawing at your shirt because they do that, right?
Yeah. It was very hard. So what I did was I had to change my routine up because breastfeeding was part of the daily routine. So I just made sure that we gave him a bottle of milk. I still had frozen breast milk, so we finished that up. But the key is really consistency and really like talking to him. So talking to our babies, even if they're 1 or less than 1, is so important because they do understand us and they know what's happening. They're observing. So really just saying, Antonio, Mama has to stop breastfeeding you. Because you're gonna have a brother. But of course that's not the reason. It's just like, anak, we don't want to blame the younger sibling, right? So I take that back. So so Antonio, I'm gonna stop breastfeeding because you're gonna eat more and you're gonna grow healthier. And so very positive feeling. So even if he was with me and sad, you just replace it with a hug and I love you, and then a little bit of a distraction because again he's a 1-year-old. So when it came to sleeping time, I handed him off to my husband to do the routine. Up until it took about a week or 2 until he fully understood. He would still try to like grab my shirt and like hug.
Aww.
Yeah. But the key with everything, with parenting, right, it's consistency. And that's the only way they'll understand what's happening. And that's the difficult part. I did have the first few days na, okay, no breastfeeding. And then they're there with their sad eyes. Okay, here, I'll feed you. And then, back and forth. But it just makes it more difficult for them. And of course, we want to make the process of weaning the easiest possible.
Yeah.
So it would be, one, starting with our attitude. Like, we're not sad. Of course, we're sad, but we're not sad. Like, anak, you can do this. Show them your calm exterior. Relax, no stress. And when they get upset, you don't get upset, right? You still show them your calm self.
This is very
That's very
positive
hard.
parenting of you, right?
Yeah.
And
And
that's
I
why
like it when she said, you have to be consistent.
You're right.
Yeah. It's really that.
Yeah.
It's
Put
being
your emotions
consistent
aside.
and being patient. And because our kids react to our reaction, right? They feed off our emotion and our reaction. So the calmer and more positive we are, the better experience it is for them. Yeah, you understand though. But I understand in the moment, you're either upset or angry and all your feelings are there. But it's again putting that aside. Again, a mother's job. We'll always put it aside for our kids. So, just with that train of thought, this is my goal. This is our limit. Our limit is, anak, no more breastfeeding.
Yeah.
But I am still your mom. I love you. I will do everything else. So, with that thought that, we have to also take care of our bodies, that reflects for our children. And they understand that even at 1.
Okay.
No, so how is it? Parang, because when do you get your period? When you're breastfeeding? Because sometimes it takes, 6 months? Sometimes a year,
I got mine,
right?
I got mine for like 5 months.
And
I
can
was
you
still
get
breastfeeding.
pregnant even if you don't have your period and you're breastfeeding?
Yeah, that's what you call lactational amenorrhea. And it usually happens in the first 6 months of exclusive breastfeeding, direct feeding.
It has to be exclusive.
Yeah, exclusive.
So you can't be pumping.
Cannot. Yeah. You're not pumping, you're direct feeding, and as soon as blood shows, as soon as you get your first period, then you're no longer, you're already fertile. You're ovulating already. Yeah, you're no longer safe.
Why is it that you can't be pumping on the side? Why does it have to be direct? Does it have something to do with like the exchange?
They find that it's just not really.
No,
Is it scientific?
They just find that it's more it's just a more consistent way of stimulating the body to prevent ovulation. Because if you're pumping, it's more erratic, right?
Yeah.
It's really not.
I see. I thought there was something to do with like the exchange of saliva,
And it triggers the hormone.
Yeah,
No.
No pala.
But that's what they say about lactational amenorrhea. If you directly breastfeed exclusively for the first 6 months, then you'll have that amenorrhea and you'll be safe for that time being.
So if you don't have your period and you breastfeed exclusively for 6 months, you cannot get pregnant.
Yes.
But that's only for the 6 months.
Yeah,
Sorry.
after the 6 months. If you already got your period, then you're ovulating, then you can get
But
pregnant.
what if you still don't have your period till like age 1? So you're still safe.
Yeah, there are.
Because you know what I mean? Because
Are
I
you?
breastfed Olivia for 2 years. So I think I got my period like when she was 1 already.
All right.
So am I like, well, I think I was safe during the time. But
As
for
long
other
as you're
people,
not, as long as you're not menstruating, you're
then
safe.
you're safe. Okay. Okay.
Yun pala yun. So
Just
it's not the
making sure.
breastfeeding, it's the menstruating that you have to watch out
Yes.
for. Okay, copy. See?
Right?
Learns Andi, take note na.
Yeah, but when you're
note.
breastfeeding, it takes a longer time for your menses to come in.
Yeah.
Yeah, so you're safer for a longer time period.
What was yours again? When did you get your period after Olivia?
She was already 1.
Grabe.
Yeah.
Grabe.
Diba?
Yeah. I remember when I had my firstborn and then I got my period after 6 months. I was so hassled. I was like, ang hassle pala magka-period
What do you think?
Maging
Almost
babae.
like 2 years.
Yeah.
I was like, what?
What's
I have to buy like
the pads again?
pads
and
and how it
everything
feels
else.
pala.
Hassle. It's 9:56. If you have any concerns like Andy's, shoot us a message. 6310899. Okay, so Ria,
Yes.
you're a sleep consultant. What do you feel about co-sleeping and breastfeeding? Because diba, some sleep consultants, some sleep therapists also, they say that it's not advisable that you co-sleep.
Okay.
But they're still breastfeeding advocates. So what's your take on it?
Okay, I'd like to differentiate co-sleeping.
Okay.
So we could define that as room sharing
Room
versus
sharing.
bed sharing. I think that clears up a lot of the issues.
All right. Okay.
Because when we say co-sleeping, it could mean either, right? Like literally in your bed with you or in a crib next to your bed.
Okay.
So, just going with my example with my first son, I did everything quote unquote wrong or unsafe for sleep. I put him in the bed.
Okay.
So there were loose pillows, blankets.
Yeah.
An adult mattress is dangerous for a child because
Is
it's too
it?
soft. See, so there are small things I didn't know.
Okay.
Because I was in my head, I was preserving breastfeeding, so that
yeah.
was easier. But now, after studying and the experience and learning about SIDS, which is sudden infant death syndrome, but there's a difference because that one means that there was really maybe something medically wrong with your child that might have caused the death. But in the U.S. now, there's a new term called SUIDS or SUIDS, sudden unexpected infant death syndrome.
I've never heard of that. Okay.
So this means this is preventable. It is unexpected because of something that might have caused the death, like sleeping on a soft mattress, getting stuck in a pillow, getting stuck in a loose blanket. See, I see your face. And that's exactly how I felt when I first learned it. It was very shocking. And I was just very lucky that nothing had happened to my first son.
yeah.
So now when I talk to families, I really take the time to explain this because it's a reality that our children could get stuck in the bed because their necks are not strong. So even if they look like they're breathing, we don't know the quality of air.
Scary.
See, so yeah, it's really scary.
Scary.
So after that, when I learned this when I was pregnant with my second son, so I said, okay, how am I going to be able to sustain breastfeeding and sleeping, right?
That's right.
So the solution would be to just put the crib in your room.
Okay.
Or crib or playpen or bassinet, anything that's considered a safe sleep space. You can put it next to your bed. And it actually just takes a lot of extra effort because you'll have to physically sit up, pick up baby, put them to your boob, and then lay them down again. But I feel that this is a small sacrifice for the safety of your child.
Well
Because
said.
especially when you are tired and you're sleeping in your bed, and especially with your spouse, we don't know what could happen. And also my first son rolled off the bed. So that was also my wake-up call
Mine
to
fell
use a crib.
twice.
Mine too.
Mine too. Don't worry. I think it happens to everyone.
Babies.
So, yeah.
But it's okay. Nothing happened. We're
We're
fine.
good. But yeah, so if we could just take that extra step. I mean, we're doing everything we can for our child. What's a few more steps at night? And I know this is the most ideal. I know we might sometimes still fall asleep holding our baby, but at least if you're sitting up or you're alert or you know that my system will be to put them down, you have a better chance of keeping your baby safe. So so I was able to still breastfeed no problem at night. And then when it comes to sleeping, just to plug this in, it would depend on the development of your child's weight and height and the recommendation of your pediatrician. So with my first son, I thought I had to feed every 2 hours, even if he was 1 year old.
Wow.
I didn't know because he couldn't
Lasted
sleep.
till 1.
I was a sleep-deprived crazy mom because I didn't know what to do. Like I did. I co-slept and all of this. And I talked to my pediatrician. He said, no, Ria, it's time for your son to sleep more than have milk at night. So it also comes to that point. And when you get there and your doctor says, okay, you can feed just once or twice a night. You know, it doesn't have to be like a constant latch. That's a good time to practice laying them down. Because that will also help stop the only latch boob answer to everything. So it gives you back your life balance. You are feeding your child, but you now have the luxury of sleeping the 2 to 4 hours and meeting both milk and sleep needs together.
Yeah, because that's these babies are milk hungry. They are. They love the boob. You have to try to get them to
No, and
space it out.
sometimes you don't know if they're feeding or they're just latching.
Yes.
For comfort.
Yeah. So you have to be also very observant. But again, for a first-time mom, it's very hard. So I tell you this now, after the second child saying, okay, I observed and I learned. But I wouldn't feel it, again, it's hard to get it. But in practice again. And a lot of observation.
Yeah. Oh my gosh. Heat up. It's 10:02. If you have any questions, again, just send them over. You can call us up 631-0899. We have a pediatrician and breastfeeding advocate, Dr. Faith Alcazaren and Ria Campos-Lopez, who is a sleep consultant and positive parenting specialist. We're doing this episode for Breastfeeding Month.
Yes, which
The
is
end of it.
August, so it's perfect. But hey, a lot of people are sending their hellos. Just want to say hi to Nikki Villahermosa, all the way from New Zealand, who's listening via Facebook Live. So if you guys want to go check it out, it's on the Facebook page of Magic 89.9 and the Mother Show PH. Want to say hi also to Lorna Cube, who says hi to Faith and Dino.
How cute.
And saying hi also to Dane Buenaventura, all the way from Canada.
My relatives.
Oh my gosh! I love it!
Galing.
Is that how I say
supportive.
Dane? Dane.
Diane.
Diane. Hello, 631-0899. Somebody was calling. They put it down. Okay, so I have a cliffhanger before we pause for a break. So just to know. So we're gonna talk about myths in a while. So if you have any myths that you probably heard of, you want our professionals to verify, just send them in. So this is one. Is it advisable to rub the nipples with a towel to make quote-unquote calyo on the nipples to prepare it for breastfeeding? So is it advisable to sort of make the texture of your sounds so weird for 10:03 in the morning, right? I mean, the only radio show that you can talk about nipples and it's fine. So is it okay to create friction so that medyo may kalyo siya to prepare it for breastfeeding? I heard this before. Yeah. So that it becomes sort of stronger and you don't get cracked nipples and stuff like that once you start breastfeeding. You guys are laughing at me now.
Weird.
But this is a thing.
You're exercising your nipples just to prepare for
you're not exercising
the marathon that you're going to do.
Parang You're getting them ready for war. You know what I mean? So is it advisable? Is that a thing? Have you heard of that before? Think about it, professionals. Your giggle is already an answer in itself. But, so before we paused for a break, we were asking you about this myth that I came across from a random person. Should you gear up your nipples for war? Is it advisable that you create some friction to make them measure rough so that they don't bleed when you start breastfeeding? Have you heard of that before? Is it absurd? What is it?
Frankly, I haven't heard of it before. But cracked nipples are not brought about by your baby. It's brought about by the wrong latch. The wrong latch. So you don't... So if the latch is not deep enough...
Solid.
Yeah, if the latch is not deep enough, then it will tend to rub on the hard palate more every time you feed. That's why it forms like... So you don't necessarily have to roughen the nipple to make it...
to ready it.
Yeah, so to make it less prone to cracking.
No such thing.
Yeah, so cracking really happens if the latch is incorrect.
So going back to that email, when she said that she had bleeding nipples, is that because of the latch then?
Probably not, because her child already had teeth.
Biting.
Yeah, the child was already biting.
Okay, I see. All right, good to know. It's 10:10. Before we pause for a break as well, somebody called us. Magic, hello? Are you still there? I hope you're still there. Hello?
Hi.
No. Okay, so he was
lost
Mon.
him. Oh, okay.
And he already asked us, hello?
Mon, are you there?
No more. Okay, so it was a male caller. He was asking for his wife. They wanted to try to give their baby the bottle.
Okay.
But the baby was not having it. So that was one question.
Yeah. So he mentioned also that he's also collecting breast milk, right?
Yes.
Yeah, and they're having a difficult time shifting to the nipple. So the same thing happened with my child, frankly. But
cup. So the solution is cup.
I did cup. Yeah, but not all parents are able to cup feed if they don't have the right training.
Okay.
So if they want to cup feed, then it's better to have someone come over, a lactation counselor, to train them, all the caregivers, down to the lola, and down to the in-laws, because it's something that is learned, and if they don't like it, they probably won't do it.
So there are cons to giving them the cup that you're not trained to do so.
Yes, because the baby might aspirate on the milk. So that's another health risk. But if they so want to use the nipple, the teats from the bottle, then it depends on the situation again. So I don't force my patients to cup feed. I don't force them only because it depends on the family situation at home.
But what month is it safe to cup feed?
Well, as I said, it's
newborn.
Even from birth you can cup feed your baby. Yeah,
Okay,
there's a technique in cup feeding. In the nursery, the babies there's a lot of them are cup fed. Well, actually they're not allowed to use the nipple anymore because of the milk code.
Yeah.
No, so they cup feed the babies there.
But what if you have no training and, for example, your baby's 4 months? Is it easier, like, to try to cup feed?
Is there less risk?
Yeah, is there less risk? Since
Well, they will really take it like puppies. They will. That's
Lap
how they
it up.
did. Yeah, they will lap it up like puppies. But it still depends on the technique. You don't pour the milk into the mouth. You don't do that because you let them take it.
So you do it slowly.
You do it slowly. And it has to be a return demo process from somebody trained to do it. But if this is not an option for you, then you teach your child to take the bottle if there are no other options.
a lot of moms would probably just YouTube it, right?
Yes.
And just be like, so this is how to cup feed, diba?
The age of YouTube, everything, how to tie a tie, how to tie everything, how
But
to
it's different. It's different if somebody is there to hold your hand to teach you. Compared to just watching it on YouTube.
That makes sense. That makes a lot of sense. Okay, 10:13 is the time. Again, any questions that you might have, 6310899. Magic, hello?
Yes, hello. Good morning.
Hi, good morning. Who's this?
Yeah, this is Mai from Makati.
Mai from Makati. Welcome to the show.
Thank you. Yeah, I just have a question. Kasi siguro 4 months after giving birth to my second child, I lost, I think, mga 5 pounds.
Okay.
Yung normal weight ko before getting pregnant.
Okay.
So, 50 kilos ako. Tapos, ngayon, I'm less than 50 kilos na. Tapos, we had a check-up sa baby ko, yung every month, monthly baby check-up niya. She also did not gain weight. So, ask ko lang if meron ba yung relation sa akin also of not gaining weight. Tapos siya rin, hindi na siya nag-gain ng weight. And because of that, exclusive breastfeeding ako. So ngayon, parang nag-mix feeding na lang ako. Binibigyan ko na rin siya ng formula.
Yeah.
I'm not so sure if I'm giving her enough milk. Pero I'm taking naman yung mga lactational, like yung mga fenugreek, yung mga mother's milk, mga tea for to have enough milk to breastfeed her enough naman. Kaso hindi siya nag-gain ng weight, nagulat kami. So I just want to know if it has something to do with me losing weight also.
Yeah.
Tapos
Relationship.
kasi I was diagnosed gestational diabetes in my firstborn ko saka ngayon. So yung secondborn ko, talagang nag-diet na ako since 3rd month pa lang. Kasi alam ko, hindi na ako papasa sa OGTT Nung dalaga pa ako, I was diagnosed with diabetes mellitus.
Okay.
Wow.
So, ngayon, talagang super kain na ako, even sa breakfast. Hindi kasi ako sanay nag-milk. Nag-rice ng breakfast. Kasi nga, pag may diabetes ka, syempre medyo diet. So ngayon talagang super calories talaga, kahit na bawal sa akin, pinapatas na kasi nga I feel so sorry for my baby. Hindi ko na alam gagawin ko. Tapos minsan yung baby ko, since 6 months na nga siya last month, minsan kahit na parang busog-busog na siya, talagang hindi ko alam kung na-overfeed ko rin. Tapos I'm so shocked pa rin, bakit ganun, no? She did not gain weight on her 7th month baby check-up. So, ask ko lang if it has something to do with me losing so much weight na hindi ko rin alam kung bakit kahit na mega lamon na ako.
Yeah. So, first, don't blame yourself just yet because this is a complex problem. I'd like to know how it was managed initially when your pediatrician found out that you are not that the baby is not gaining enough weight. What were the measures done to evaluate?
Wala naman siya sinabi. Sinabi lang niya, I think you're in the petite side. Yun lang.
Okay.
Tapos he asked kung ano yung mga pinakain ko. Kasi 6 months pa lang siya nag-solids. So, sinabi ko yung avocados, mga broccoli, blah, 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 yung mga healthy foods. So, tapos, prunes, kasi minsan, parang na-constipate siya 2 days. Hindi siya nagpo-poop. So, prunes, natural na laxative. So, nag-work for her. Tapos, rice, pinapakain ko na rin siya ng rice.
Alright, so in the first 6 months, your baby was gaining adequate weight? Or mabagal din?
Okay.
Mabagal din ba nung first 6 months?
Yung first 6, no.
Slow din?
Siya almost, almost double yata. I forgot ng weight niya. Yung pidya niya natutuwa sa kanya. Nag-stop nung kami introduce kami ng solids
nag-slow down.
Oo. Hindi siya nag-gain, nagulat ako.
So it's not really your fault, mommy. But a lot of it also has to do with your nutrition. So the nutrition of the mom really affects the quality of the breast milk. So that's one. And then secondly, has there been any change in your breastfeeding habits? Are you still exclusively breastfeeding?
Ngayon na lang kami
nung nag-complementary.
Opo.
Okay. So, I would suggest, you need, kasi you said lamon ng carbohydrates, all those things. You need a nutritional plan, actually.
Yeah, I did, man. Like, mga malunggay, chia seeds, lahat na kami lalagyan ko ng chia seeds.
Yeah. Because right now, when in the complementary feeding phase, your baby still depends on your milk.
Okay.
Yeah. So the solid food really has very little contribution in sustaining your baby's maintenance and needs in the body. So what you need to focus on is your milk supply.
Okay.
Okay. The question is, are you producing enough milk? And is your baby extracting the milk efficiently? So those are two different factors because sometimes baka nagkaka-change in the latch or the positioning. That has to be corrected with your pediatrician or lactation counselor or a lactation consultant. So they have to evaluate the mechanical factors first, no? A lot of moms feel guilty about this one because they feel they're already taking all the galactagogues. Now, that's what I don't like about galactagogues. It may increase your confidence, but it also can bring it down. No, because
I've heard of that.
Yeah, if you're taking it and your milk is still not enough, then you tend to blame yourself. So why is it that you're not producing enough milk? But the initial management of this would be to correct the mechanical process. How the baby is sucking. Is the baby draining your breast well? So for example, pag nagdede siya in one session, are you able to express a lot of milk after it? Because it may be possible that your baby is not getting the hind milk.
Yeah.
The hind milk, it's the fatty portion of your milk, and it's the last part to go during a breastfeeding session. So maybe that's the reason. So if you would, one solution would be after your baby breastfeeds, you top up with hand expressed milk from your breast, and then painom mo sa kanya.
I see.
Yeah, para maubos. And then that will drain your breasts more effectively. The more effectively you drain your breasts, the more milk you will produce.
Okay.
Kasi kung inadequately drained yung breast, if it's not adequately drained, the body will not produce enough milk.
I see.
So, those are just several factors that might affect milk production. But I also want to know if you're stressed out. The more you are stressed out, the higher the stress hormones in your body.
Yun lang.
And the cortisol levels are high.
Yeah.
Now, cortisol counteracts milk production.
Oh,
Yes.
grabe, no?
So if you're so OC about every drop that comes out,
Okay.
if you're stressed out and you're not eating well, you're eating all the carbs but not the right nutrients, and you're lacking in certain micronutrients, all those are factors that contribute why your baby's not gaining enough milk. So maybe your baby's not getting enough milk because he's not able to drain it all out. Baka since distracted na, he finishes one session immediately. So try to extract hand express and then top it up.
Okay.
Give the rest and then
It's funny how the body works, no?
Yeah.
It is
Parang
so funny.
if you're stressed, then you're not going to produce milk. So you kind of
Yes.
have to like trick your mind into thinking that you're relaxed and you're going to have milk. Diba? Ganun yun eh. It's a mind game.
Yeah.
That's
But-
why,
yeah.
if you're more confident, the maternal confidence really correlates with success in breastfeeding.
Yeah.
So do everything to be more confident about what you're giving
Yeah,
to your
it's
baby.
so hard.
Good luck.
Because sometimes, when I pump also, it's not enough milk, diba?
Yes.
Parang you feel
And
like,
you'd
it's
worry.
just like 1 ounce. And then you start to worry. And then you look at your baby, you're like, parang she's getting enough milk na.
Eh, yung baby mo, hello.
But Olivia was not like that eh.
Yeah.
Diba? This is different.
Okay. Yeah. Okay, thank you so much for your call.
Thank you.
And good
so
luck,
much.
Good luck.
Thank you. Bye.
Okay,
Yeah,
bye.
sorry, can I add?
Oh, sige, go ahead. She's still
No,
listening.
yeah,
Go ahead.
so it just also I wanted to add because this happened to my son at 10 months where we went to a well baby check and he didn't grow. It's my first son, and my doctor said it could also be sleep for the baby. So make sure that your baby is getting enough sleep as well. So it goes along with feeding. So just make a good schedule
That's
of
right.
enough milk, timing of naps, and timing of sleep at night as well.
We bring up this topic of breastfeeding, but really it's all these things.
Yes.
It's nutrition. It's all about the mom's nutrition as well. It's sleep, and it's true what they say that the first few months all they really do is sleep and eat and sleep and eat and sleep and eat, and they have to get an adequate amount of both.
Yes.
Right, an adequate amount of both. So it's 10:23. Again, if you have any questions, just like that one, all you have to do is hit us up. It's at the Mother Show PH.
Okay, so I have a few questions on Facebook that people are asking. Somebody goes, "Hi, for a new mom like me, I have a newborn, and the third day, tuwing ilang oras kailangan ilatch si baby, and is it every 2 hours? And I'm on my 6th month of pregnancy."
Whoa. Hold on.
Wait. Again.
Again.
For newborn, like 1st to 3rd day, tuwing ilang oras mo kailangan ilatch si baby? Is it every hour or 2 hours? I'm on my 6th month of pregnancy.
Because she's expecting.
First to third day of life. So in the first to third day of life, I always tell my patients to go by the baby's cues, hunger cues.
Okay.
So if the baby starts to tongue and lick and look for the breast, that's the time to feed. You don't wait for the baby to cry. So there's really no schedule to it. But I keep on telling them, don't let 3 hours go by without feeding.
So you have to wake them up.
Yes.
For newborns.
Offer the breast. Otherwise, there are babies who can sleep very long and they end up hypoglycemic with low blood sugar because they haven't had a feeding session.
Yeah.
So for newborns, you have to feed on demand. You wait for the feeding cues.
Yeah.
If the baby is deep in sleep, you try to open the diaper, unswaddle the baby. Kasi they sleep very... But they only have 2 sleep cycles. It's easy to wake them up.
Yep.
They're arousable.
Okay.
Just unswaddle, and then they will wake up and offer the breast.
Okay.
I
see.
Okay, another question. This is for Ria. Somebody goes, any tips for getting fuzzy toddlers to sleep through the night?
Okay.
This is gonna be like 1 hour, by the way.
Okay.
It's a workshop.
Well. Wait, hold on. Before we get to that,
Yes.
it's 10:26. Let's just get a call, di ba? Kasi
Okay.
medyo matagal yun eh. Magic, okay,
Oh.
not that one. Magic, hello? Hello?
Hi.
You are on the air. Magic, hello?
Well, if anybody wants to call us and ask all the professionals here in the booth, you guys can call us up 631-0899.
Oh, sige. Let's get na nga to that. No,
Sige.
go.
Let's get to
How
the
do you
question.
get them to sleep through that? I
Yeah,
want to
the
know.
fuzzy
this too.
toddlers.
Okay.
Toddlers.
Game.
Okay, well, it starts with a few steps first for toddlers. So for our toddlers, we want to make sure, of course, that they've eaten well through the day, right?
Yeah.
So it's 2 things. Are we completely weaning them from our breast, or are we just getting them to sleep through the night? So if we're still breastfeeding our toddlers, so like me, I'm still breastfeeding during the day, but at night, I make sure that I have a solid bedtime routine, which is an early bedtime, and I make sure that breastfeeding is not the last.
That's so hard.
Yes, okay, because one of the biggest habits that we have is breastfeeding our children to sleep.
Yeah.
Which is the best, the easiest one. Yes.
Yes, but that's counterproductive now to independent sleep. Because that's the only way they know how to sleep.
Okay.
Right? So it's learning. It's a learning process. So we want our child to sleep independently. So we include breastfeeding, but at the start of the routine. So like maybe after dinner, you can put it in your wind down.
Okay.
But allowing
Wine?
we could include wine.
Wine down? In your everyday routine.
Thirsty. Okay, sige.
Yeah, so you can include breastfeeding if you'd like, and then allow enough time to do the rest of your routine. So to take a bath, brush their teeth, right? Because they have teeth now. Brush their teeth, pajamas, a story, and a prayer or song, and lights out. And you just have to be very consistent. The more often you do your routine, right, they'll learn the steps. So I always tell my friends and family, guys, it's like telling you 1, 2, 3, sleep. So like us at home, right, you have your routine. You go to the bathroom, wash your face, and then lie down. Same for our babies. They need to have that consistent schedule, and also falling asleep independently, because if they fall asleep on your boob in the middle of the night, they expect that your boob is still there, right? However you fall asleep, when you wake up, that's your same expectation. So it's like us. If we fall asleep in our bed and we wake up in the bathroom, it's like shock and what's
what
happening.
is this?
So it's the same thing with our babies. If they fall asleep on the boob or with you and you put them down, it's sort of like you trick them. Like you say, okay, you stay there. So of course when they wake up, it's like, where's mom? Where's, what I'm familiar with? So we have to first start there from the falling asleep part. Then when it comes to the middle of the night, you just have to stay very strong. So again, it's firm and fair parenting. We set the limit, which is acceptable to us, which is no more breastfeeding, especially because they're over 1, right? And we sort of just have to be, again, very patient, and I'll say it will sit through the upset with them. Yeah. And we replace the breastfeeding with our physical, loving, calm presence for them.
At 3 o'clock in the morning.
Yeah. And it takes about 3 to 5 nights of, I would say, major upsets. It could take a long time. Then you will see improvement every day. So if the first night they were up 3 to 4 times, and to the extreme, maybe an hour each, but again, you just have to relax. And every day it'll become shorter. And hopefully by the end of the week, 10 days, we have what we call broken the habit or broken the sleep crutch.
Oh,
so it's really patience and consistency. Yeah, and of course, always telling them, so being positive and telling them what we call the good news. So, okay, anak, no more feeding tonight, but tomorrow morning, we're gonna have as much breast milk as you want.
Oh,
I'm gonna spend time with you tomorrow. But tonight is for sleeping. And that's it. So it's really just setting that limit, following through. And again, also our attitude, no, anak, tulog ka na. Anak, go to sleep na.
That's that's frowned upon. That's not
good.
Well,
because then that's 2 things. 1, it's the negative energy. And 2, our babies think it's a game. Oh, mom's engaging with me. Mom's talking to me. So,
in the middle of the night. Oh.
And that's the mistake we make because a lot of time we're like, sleep na, please, sleep na.
Yeah.
And so it's really just, okay.
Tricky. There is no manual for this motherhood thing. So it's
So even if they like super cry, you just have to be calm, right?
You just have to be calm and give them a hug. Replace your feeding with a hug or a kiss or snuggles.
But I can just imagine how they just lift up your shirt and try to battle you to the boob. You know?
And then if it's hard for you, enlist your husband to help. Get him to carry. Get him to.
Because they're snoring in the side.
Yeah, it's their time because there's no excuse na I can't feed. Okay.
It's your turn.
So it's your turn.
Not feeding, it's talking. It's 10:31. Again, 6310899. Any questions? We have our experts here to answer the magic. Hello?
Hello.
Hi, who's this?
Hi, this is Jenny from Taguig.
Jenny from Taguig. What's up, Jenny?
from the block.
I know, right?
Yeah. Yes, I have a question because I have a 3-week-old daughter.
Congratulations.
Yeah, thank you. And then the advice that you just gave about the bedtime routine, is that applicable for newborn as well? Or does it have like a recommended month?
That's
good
a good
question.
You can start as early as now, but don't really expect results. Parang, it may or may not work because from 0 to 4 months, actually, feeding to sleep is still not, regular. Our babies don't usually learn how to sleep by themselves because they're physically not ready. So 0 to 4, they still recommend swaddling, rocking, even feeding because our priority is getting them their milk.
Yeah.
So if our feed schedule is so often and their sleep schedule is also every hour or 2, then we can't avoid it. But you could practice, especially for nighttime. Like you could put in your bedtime routine or ritual this early. So like the same song or the same prayer, right? So they know their cue for sleep.
Okay.
That makes sense.
Okay. And then another question is that because right now, for the past 2 weeks actually, I've been breastfeeding fine. I've been alternating my breasts to feed the baby, but just like yesterday, I noticed that my left breast is larger than the other one, and she's latching more or she's feeding more onto the left compared to the right side. What should I do?
Don't
even it out.
Take care of both of them. Don't neglect the other boob. So, like I said, your body will respond to demand. So if your baby's favorite is the left one, try to offer the right one after the left one. So don't neglect them. The right boob will stop producing milk if you don't always latch on it.
Okay, so I just continue alternating both.
Yes. Or offer the right one
First,
more.
right?
Yeah,
Yeah.
offer it first. So take care of the right one.
Take care of your boobs,
But does that
guys.
happen like one produces and then the other one stops?
They call it a
It happens.
slacker
With
boob.
the last one, should I be pumping it already to drain it? Because I haven't drained anything yet. I don't know when to start because I
Good
don't want
question.
to
When do you
oversupply.
pump?
Well, pumping, how old is your baby? 3 weeks?
3 weeks.
3 weeks. The earliest you could do that is around 5 to 6 weeks. Yeah.
5 to
When
6
your
weeks.
breastfeeding is more established. So right now you're still getting the hang of it, right? So the left one is producing more milk. Now you have to relactate the right one. So
Relactate.
you offer it more often.
Yeah. Okay.
And then if you can stimulate it with the pump. Or pump it more often or do hand massage. Hand massage is more effective because your fingers are more sensitive and it can feel for the small lumps around the breast tissue. So you can do hand massage on the right more frequently during the day to just increase the supply on the right breast.
Okay. And if I pump more or I feed her more on the right, does it mean that I should stop on the left or, because it hurts when I don't feed her on the left because it's getting full.
No, the key is to empty both breasts completely.
I see.
Yeah. So if you feel that the left breast is full, you have to drain that. You drain it either by expressing the milk or giving it to baby. You let the baby latch onto it. And that's the most efficient way, actually. The babies are more efficient in draining milk. So just offer your breast on the left.
They really are.
Yeah,
No? Yeah,
yeah.
they really are.
They're more efficient than the pump.
Okay. All right. Thank you so much.
Thanks, Jenny.
Bye.
It's 10:35. What were you I was gonna ask a question kanina. Yeah, when to pump. So it's ideal. But there's some medical issues that arise early on that you're supposed to be pumping already. Because I know some moms who bring their pump when they check in the hospital.
Yeah.
When is it advisable to pump before 6 weeks, 5 to 6 weeks?
If there are conditions when you cannot directly breastfeed, but you can offer your expressed breast milk. So one example would be conditions that require contact precaution. For example, the mother at birth developed chickenpox 5 days before giving 2 weeks before giving birth, and 5 days before giving birth and 2 days after it.
What luck, no?
Yeah, if you develop
luck.
that, you will still have active lesions by then. So any contact with the skin of the mom can transmit the infection.
Okay.
The same goes with tuberculosis. So if you are diagnosed with it, you can offer the breast milk, express breast milk. You just pump it and then offer it, and treat the mom for 2 weeks. So after 2 weeks, or maybe the mom can just wear a mask. But treating the mom first for 2 weeks is the safest.
Yeah.
So you don't transmit the disease to your child.
I see.
Yeah.
Wow. Yeah, but I heard of that. 5 to 6 weeks, that's the only time you can pump because you have to have a stable. Your
Yes.
body needs to know how much to produce.
Correct.
According to your baby's needs.
Yeah.
Diba yun?
And the mom will become insecure before 5 weeks if she continues to pump early because she won't get enough. She won't get enough. She only produces enough for her baby by that time.
I see. Okay. Kasi maaga pa, diba?
Yeah, it's too
maaga
early.
I see. It's 10:37. Magic, hello.
Hello.
Hi. Good morning. Who's this?
Morning. Si Koji.
Chico G?
Koji.
Koji.
Koji, what's up?
Actually, medyo related sa topic.
Okay.
2 years old na kasi yung baby namin.
Okay.
Kaya lang, ang problem, nung nagkaroon kasi siya ng nangyaya na in-spoiled siya kasi nung nakilig siya sa fried chicken. Saka sa hotdog, puros ganun na lang.
Okay.
So ngayon, ang hirap ng pakainin ng iba.
Ria, do you wanna take this?
Yeah. Okay. Well. Okay. First of all, that's common topic also.
No? Fried chicken also.
And I don't want to say, kasi we're gonna say picky eater, and I don't want to use that label. Okay. So for the first is to not label your child. Okay, they are not picky or they are not difficult. They just don't know any better.
Right? That's nice.
Yeah.
I like that.
Okay. So we have to first also make sure the food in your house is healthy food. Are you, sir, and eating also healthy food? Because that's the first. Your child will role model the food you're eating. So we cannot eat fried chicken and tell our kids, anak, you'll eat your vegetables and rice, ha?
And we'll eat fried chicken here on the other side. Yeah.
Okay, so very important. The first is really role modeling the healthy eating. And then the next is exposure to different kinds of food. Okay, so we want to move away from fried food. So we'll start offering healthy food. In small steps, of course. And then, of course, also the presentation. So, our kids don't know what it is. Let's say fish. They've never seen fish before. The texture is different. They may not want to eat it.
Yeah.
So, again, it's offering many times. They call it exposure. So, you might have to expose your child 100 times to a vegetable.
Wow.
Before they take it. And when we talk about exposure, this also means being able to hold it, look at it, because sometimes they are affected by the color, the texture, the smell, and even the way you give it to them. So sometimes giving them a whole slab or a whole bowl is too much, but you could offer 1 or 2 pieces. And again, it goes back to us being very calm and patient and not saying, anak, eat your food. You have to finish this. You have to eat this. It's really like, oh, here, why don't you try?
Yeah.
Let's try. And then you eat. And you say, oh, anak, why don't you try? Right? So, very slow.
Even at 2?
Konti-konti lang.
Yeah.
Kahit sanay, like let's say in Koji's case, sanay na siya eh. So what if mag-tantrum siya during mealtime, wala siyang makain? Is that okay?
Yes. That's okay also. That's also expected.
Okay.
That they will so then it goes back to positive parenting. Your child is upset. We will not be upset. Okay? We have to, it's very hard again.
Breathe in, breathe out.
Yeah, we will not be upset and we'll just say, okay, we will try to focus on something that was positive. So if your son picked up the carrot, anak, you held the carrot today. Yay! That's great. Okay? But but also no need to celebrate. It's you picked up the carrot today.
Sorry.
That's okay. Sorry. No, sorry. Kasi then that means you'll have to do that for every meal. It's not sustainable kasi.
Bring out the party poppers!
So, but Riki, if you have that energy for every meal, why not? Because it's really, again, it's your consistency in parenting. So if you can celebrate every meal, great. So we appreciate the small efforts and you give them so let's just say that meal was a bust because tantrum through the food, everyone's upset. You just say, okay, anak, you know what? That was a good try today. Let's try again for dinner.
Oh, that's a good way to put it.
Right? Yeah. Always repeat what they did good at that time, that they tried, they held, or even just sitting down. Oh, you sat down. That's, always give them positive feedback on what they did. Don't go back to the negative. Don't say, ay nako, you threw your things. Ay nako, such a bad experience. Right? Always, that was a good try. And then we'll try again later. And then we just repeat.
Consistency lang yan, Koji.
Yeah. And you just have to be firm but kind. So there's a limit. We won't allow our child to throw the food. So if we tell him, okay, anak, this is your food today, that's it. Also, don't go back and say, oh, he won't eat his carrots and rice. I'm going to give the fried chicken. So no, there's no backup, okay?
Yeah. Walang backup
So when we say there's no food, and I'll ask Faith now to answer. Kids will eat when they're hungry, right? They will come back to you. I mean, is skipping a meal not so bad?
If they miss a meal,
it's fine.
It's fine. They won't die from it.
Parang,
but parents usually worry. But the key is not to offer snacks in between.
Yeah, that's what I heard. Like, starve them. So they eat a lot.
They will eat. They will eat.
Diba?
Yeah, they will.
Marunong na magbukas ng ref eh.
Ay, maglagay ka ng lock.
Hindi, dapat yung laman ng ref.
Oh, yan.
Yung
healthy.
sa pinakababa. Fruits,
healthy what you want him to eat.
Yeah.
So you can always offer food, but now it's offering healthy food, and that's the extra effort that the parents have to take. Yeah,
they should be healthy. Carrots or apples?
Yeah.
Kaya yan.
Update us, ha? Pa-update na lang, Koji.
Sige.
Okay.
Thank you.
Thank you.
Grabe, no? 10:43.
Okay.
That's so tough, though, because crunchy is life for these toddlers.
I know, especially fried chicken. I mean, that's
your favorite.
hard to let go. But anyway, I have somebody who's asking a question via Instagram. This is by Julie Padaga. Sabi niya, until when is it okay for my baby to latch while sleeping? My baby is 11-month-old and she latches until she falls asleep. There are times na wala ako at night or late ako umuwi. My problem is hindi siya nakakatulog ng straight. Nagigising talaga siya looking for my boobs. We tried offering the bottle thinking nagutom siya pero ayaw niya. So, ang ending, pareho puyat ang baby at ang nagbabantay. Kawawa naman.
Yeah.
Okay, so again, we're unlearning a habit, right? So it's feeding to sleep is the only thing that your child knows. So we have to, again, sort of reshuffle our schedule. Put the feeding earlier. Substitute feeding, I would say at this point, with hugs and cuddles and lying down and spending quality time. It's really just a mindset shift for the moms because a lot of the time it's like, I'll bring this up now, mom guilt, or I wasn't home the whole day. So for bedtime, I have to latch. Through the night, I have to feed my baby. But this is not good for both mom and child because sleep is also important. So we have to sort of make that mind shift that, okay, let's put the breastfeeding when I get home.
Yeah.
Okay, and a good time to change would be when your child has teeth because we have to brush their teeth. That's another issue, health, dental hygiene and health. So we would really like to try to get to feed earlier so that we can do the brushing of teeth, pajamas, changing, and a really winding down time. And then that can be your bonding time, hugging, having your child sit on your lap when you read a book. It's just as effective as in terms of time spent together and quality and affection. You know, it's the same thing. There's physical contact. You are there. The key is to be 100% focused on your child, right? Is to be there. Put
Some
away
quality
your phone.
time talaga.
So this is also what you would advise when, like, for example, you're co-sleeping in a bed and you want to move them to another bed.
Yeah.
So how is that transition? Because that's my problem now. Like, I want to move her to another bed, but she just wants to stay in my bed.
Sino?
Si Olivia. Because so I go like, oh, I'll just buy you a nice pink bed with a
nice
princess bed. Like, I try to like make it all so fancy, but I mean, just after one night, tapos na. She's back in my bed.
Yeah. So again, this comes from your reaction to her and what you want. So the answer here would be, Olivia. So you can sort of transition slowly. So the first night you say, okay, Olivia, this is your bed. Mama will stay next to you first. And then but don't go on the bed with her because then she'll expect that. So you can sit next to her and you can offer something that's acceptable to you. Like, can I hold your hand for a few minutes? Right? Or can I read while you're in bed? And you can even, because she's older now, you can actually, she'll understand that I will wait for you. Like, let's say, I give you 3 days. I'll wait for you here. Anak, in 2 sleeps, mama's gonna sit here on my bed. Right? And, you know, you sort of just ease her in. And if she were to come to your bed, this is called the silent return. So no reaction on your end.
Okay.
Just, so Olivia comes over.
Yeah.
Of course, you acknowledge that she's there, and just one line. Oh, anak, let's go back to your bed. Gently lead her or pick her up, put her down. No eye contact. No further engagement. Just bring her.
Gosh,
then,
this is like,
and then
I have to plan this,
man.
right?
And then go back to your bed. And again, she might pop up 100 times that night.
Yeah.
But remember, on the 100th time or the 10th, don't do.
Because once you give in, then it's back to
0.
Oh my god.
Yeah.
And you can't be like, ay nako,
Yes.
kulit mo.
Kind of like weaning.
Yes.
Yeah.
Exactly that.
It's like weaning,
the
diba?
same.
I guess when you become a mom, you have to wean like several hundred times in your lifetime. Once you become different stages, you just keep weaning and
you
weaning, and
think
they're
at
different
night,
things.
No, you think at night you're gonna rest.
Oh,
but
no.
no.
Yeah.
Gets
No.
more complicated.
No, but I think like after you get the sleep down and after you
Then
train
you're-
them that sleep is
Yeah.
important, then okay ka na
Yeah.
with sleep.
Well, let's take away the word training because we're
Sorry.
not. No, it's okay.
That's right,
I just
that's
like
right.
to because it has a negative connotation.
Yeah.
And again, we're all positive. We're all trusting in our child's capability to learn.
Yeah.
And do well. And
Yeah.
when we have that mindset, anak, you can do this. I believe that you can. When you have that confidence, even if you don't say it, it comes out in your expression,
That's
in
right.
your actions, right? And that's exactly how we want them to learn, because we never want our child to be stressed with, especially feeding. Feeding, feeding, sleeping, and potty training should never have any negative experiences.
Again, that's sleeping,
feeding, and potty training.
And potty training.
Yeah, because think about it this way. These are 3 things I cannot force you to do, even as an adult, right? I can't tell you, Ricky, you need to use the bathroom now.
Okay.
Right?
Yeah.
Or you need to eat dinner now. Right? So we can't. So we also have to follow our child. I know. So it's a very, I think actually it's really parent training.
Yeah.
This is where I use training. The parent has to learn.
And these
has
are
to
the
put the
top
effort.
3. Yeah, these are the top 3 that you should really be very mindful about. It's
Yeah.
the sleeping, it's the feeding, and
Yeah.
it's the potty training.
Yeah, because these things people treat as like tasks or chores.
Yeah.
But using the philosophy for Rai, or resources for infant educators, or following our child. You talk about Montessori, right? We follow our child's lead.
Yeah.
So that means we cannot force these things on them. But there's the good news.
Okay.
We can set them up for success. So we set them up for success by fixing the routine, being very positive, being consistent and patient.
Nice.
And that's where we go.
10:49. What a
maging
discussion. Hirap maging
We
nanay.
actually have a caller, 631-0899.
Magic, hello.
Hi, hello.
Hi.
This is Ed.
Ed.
Good morning.
Hi, Eds. Good morning.
Hi, I have a 2-year-old son, and my problem is that he bottle feeds at night. So it's like I'm having a newborn who sleeps and wakes up every 2 hours for bottle feeding.
I got you, Eds. I feel the same way. I have an almost 3-year-old.
So every
I
2
still haven't
hours,
slept
yeah.
through the night. He's still... Ay,
Every 2
nako.
hours talaga. As in,
Wow.
Okay, sorry, Eds. I'll just share my story also.
Yes.
It was just last night. It was just last night that we told him, okay, Calix, you can't have Dede in the middle of the night. Your daddy and I need to sleep. You understand? And he's like, yes, mommy, yes, mommy. And then he didn't. That was the first time we had that talk ever. Calix, we're very tired. You can't ask for more Dede. Doc Vina, our pedia. Doc Vina said,
yes.
Doc Vina said, you can't have any more. You need to sleep also because you're a big boy. And he's like, okay, mommy. And then, to our surprise, we got like 8 hours of sleep. Wow. I know,
That gets the party popper.
Yeah, and we were celebrating in the morning.
Yeah.
We're like,
Great.
Calix,
You did it.
you slept. How do you feel?
That's why pala you
Yes.
didn't need coffee today.
Actually, but anyway, and that's when I realized that sometimes you really just have to talk to them.
Yes.
Right?
They are the important key. We have to communicate with them in words appropriate to their age.
Yes.
So exactly what he understood. Anak, you need to sleep. Mama needs to sleep. Papa needs to sleep.
Yeah.
I see. Sige, I'll try that. Thank
Yeah,
you.
so
I got you. I feel you.
Yeah.
Thank you.
Yeah, so talk to your child and give them the opportunity to listen, and they understand. They understand more than we think they can, and to also not put our own emotion to them.
Yeah.
So sometimes with sleep or we have anxiety, so we also assume our child might have anxiety, right? So again, we have to remember our child is an individual. They're not just babies or they're not just toddlers, but they are the people who they are. So my son is Antonio. He is Antonio. At 3 years old, he is who he is.
Yeah.
And I have to respect him as a person. But at the same time, I respect my own boundaries, and that's the role modeling. So mom needs to sleep,
I love
right?
that,
And
yeah.
please help mama sleep also. So you sleep, and again, no negative. And the next day, always positive words. So it's great your son slept, but let's just say, for example, he had woken up once versus the 2 or 3 times. You also celebrate that. Yesterday you woke up just once. That's so great.
Wow.
There's still
It's
always
really
a win.
effort. Yeah.
Right? Because we can't
Always
expect
a
them
win.
to go from 10 wake-ups to 0.
Yeah.
That's also unrealistic. So, realistic expectations, communication, and patience. A lot of it. And I say this very hard. It's hard because I'm not a patient person. But sometimes when it comes to our kids, right, we really choose, it's a conscious decision.
It is a conscious decision.
Yeah.
Good luck, Eds.
Thank you.
Good luck.
Bye.
Eds.
It's so hard because, and we say this all the time on the show, there's a fine, like, you don't know when you cross the line of doing everything for them and then letting them do things for themselves when you're a new parent or when you're a parent of a baby, diba? Because you're so used to changing their diapers and doing everything. And once they get into their own, when do you let them go and figure things out by themselves, right? There's no specific age. It all depends on your child and your baby. They all have different, developmental milestones.
I think it also, even when as they grow up, diba, that's a problem. When do you let go, right?
Yeah.
As teenagers or as like adolescents already, you don't know.
Ang lawak ng breastfeeding. 10:53, and just like that, it's 10:53, diba?
Right? Yeah.
So far, we've helped a lot of people.
Yeah,
already.
and you guys can still send in your questions. I have a lot that I've gathered online, but somebody said her name, it's funny what she said, Diane Buenaventura.
Okay.
She goes, my baby is 3 years old. He's still feeding. I tried talking to him saying that he's a big boy na. Answer niya, hindi pa ako big. How funny how they reason like this, no? Like the toddlers.
Hindi pa ako
Well,
big.
it's a good sign that your kid can reason. That's the positive part. That's the good news. Is that it's a good thing that your kids can reason, meaning they have the cognitive ability to reason, right? Now the question is, why do they have an aversion to being adults or being a big boy? Is it because there aren't good examples of, big boys in their life, or does it mean to them that they need to be detached from you?
Yeah,
That's
right?
probably it.
That's probably it. They don't want to be, big boy na ako. That means I can't sleep in your bed. That means I have to eat on my own chair and you won't cuddle me anymore or you won't hug me. So positive parenting, coming back to that, is you need to reassure them that yes, you're a big boy, you'll have responsibilities, but at the same time, mommy's still here for you, daddy's still here for you.
Yeah.
We'll still do things together. We'll still have quality time together.
That's a good way to solve that issue. By the way, the voice that you just heard, that is our mental health advocate. She's also a professional yoga therapist from Stratum Health Partners. That was Bea Gomez-Dey. And she was telling us off air, sometimes if you're too stressed out, like this whole episode, info overload, diba?
Yes.
You're a new parent, a new mom, you're sleep deprived, you don't know what's going on. It's very important that you have your ish together.
Yeah.
Right?
That you're still sane.
Yeah, and there's a way.
May trigger warning to eh. Dapat your show has a trigger warning. Because whether like you're a new, like if I didn't have a kid or I didn't want to have a kid, mas lalong I don't want to have a kid because my nipples are gonna be like, diba? My nipples are gonna be broken. I won't have sleep.
Yeah.
I have to be patient. My child's gonna shout at me. Why do I want kids? Diba? So, there is actually a technique that you can do. And it's a yoga technique. It's also a technique that they teach for alcoholics or depression or anxiety. Is literally breathing. And sometimes, breathing is something that we neglect because we can do it without thinking.
Yeah.
But it's the power of mindful breathing that is most effective. So literally, you sit straight. And when we say sit straight, you feel both sides of your butt cheeks on your seat. And you're not leaning back, you're not leaning forward.
I feel them now.
Yeah.
All of them now.
Some of us, it's easier to feel like the bones rather than the cheeks. So it's okay. So you just want to feel stable. And for me, it's important that both feet are on the ground.
Okay.
It's a kind of a sense of grounding. So for shorter, not so tall people, that might
Why are you
mean
looking at
I feel you. We kind of have to move towards the edge of the chair. So that sensation of grounding sends a safe space to our body. Right? So physiologically, it says you're safe.
Yeah.
You're not going to fall off. Your body doesn't need to compensate for anything. If you can close your eyes, you can close your eyes. Or if your child is having a big tantrum, for example, right, and they're acting up or they don't want to eat or they're crying, you make them do the same thing and you model the same thing. You make them sit straight or even standing up, but better sitting down. Your feet are on the floor and you hold their hand.
Okay.
Right? So let's say you hold each other's hand and you look them in the eye and say, okay, Ria, let's breathe. Okay, I know it's very upsetting to you today. Something you didn't like what happened. And let's start to breathe first and then you tell me how you feel. Okay, so you start with, inhale and exhale 10. Okay, inhale, exhale 9. Inhale, exhale 8, and so on and so forth until you get to 1 or 0. And when they're there, okay, now tell me how you feel.
Yeah, you know what I noticed din kasi with these toddlers, when they're starting to get a feel of their feelings, they can throw the biggest tantrum and then
gone.
Tumatawa na sila. Pero may
Like a
tears.
switch.
Yep.
Yeah.
And you'd be like, is there something wrong with my child?
Can you believe that? And they're looking at my husband like, what the happened?
But it's kind of confusing because
So
sometimes,
funny.
like, when you read stuff online, they would be like, children are still trying to figure out emotions,
Yeah,
diba?
because they don't know what's happening.
Yeah, so what's the point where you go like, okay, leave them, let them try to figure it out, or okay, let's handle this together?
For children, what is encouraged is 2 things. One, let them feel it. They need to know the sensation of sadness, upset. Right? What is the difference to a child? You've never felt sadness and you've never felt upset. What's the difference? And sometimes they don't know how to put words into it. They're just upset. They're just angry. So sometimes sad means angry.
Okay,
Right?
yeah.
So yes, make them feel all the sensations of being
You can't shield them
sad
from
and-
it.
Yeah, you can't.
So you can't say, stop doing that.
And you see now adults coming into therapy and yoga because they don't have a grasp of their feelings. You get into a relationship, they break up with you, you're just mad. Right? You don't know if I feel broken.
I feel hurt.
I feel hurt. I
Yeah.
feel disrespected. Versus I'm just mad. Right?
So it starts
makes
like
so-
while you're sitting.
Yes.
It starts when you're
young.
And when you're young, your model are your parents.
Wow. Okay.
You teach them to label their emotions.
Yes,
as well.
you teach them how to label your emotions. So sometimes when you take that breather, you sit down and you practice breathing and identifying. Okay, what are you feeling? Okay, what are those tears coming out of your eyes? What are they for? Right?
That means you're angry.
Are
That
you
means
angry?
You're sad.
Are you
That means
sad?
you're- yeah.
Are you upset at mama? Are you upset at dada? Are you upset at your classmate? Did they call you names? You didn't like the name they called you?
This is toddlers. You can't do this to newborns.
But it's also important to
Vocalize.
speak to your newborn. Right?
Mm.
And in positive training and sleeping, you talk to your kids. The
Okay.
thing is, even with newborns, their first sense is your warmth, your presence, your emotions. Those are their first senses.
Yeah.
So they know when you're sad. They know when you don't have sleep.
About this. Yeah. And actually, just going back to the whole breastfeeding thing, I heard that you shouldn't breastfeed when you're stressed out because your baby somehow, I don't know if it's how you hold.
What if
yeah?
you're stressed out every day?
Yeah.
Then you take 20 seconds.
And
breathe
in
extra
and breathe
10.
out. I like that. Yeah.
But is that see, Doc? Is that accurate when I say that when you're breastfeeding, your emotions, your baby will feel the same thing? Is it in the way that you hold them? Is it in the way that do they taste it in your milk?
No, not really. It's you can actually transmit your emotions to your child through your actions, your behavior. But when you are too stressed, the baby can feel it in the milk because it will decrease in supply.
That's the one.
So the baby will get irritable as well because the baby couldn't get enough. So both of you will get all the more stress. That's why you need these stress management skills.
Yeah. Okay, they're called stress management skills that I think you can use at any stage in your life.
Yeah.
Right. And it's good to practice this even with your kids at a young age so that they know as well how to manage stress.
So
Right.
no matter what age you are, and I think now we rarely do it, a powerful tool is first start with thinking and being conscious about first how your body feels. If I ask you now, how do your toes feel? You
toes
probably
feel.
do not know how your toes are feeling right now. But when I, yeah, right?
Yeah,
But
yeah.
when I say, Riki, how do your toes feel?
Yeah, you're aware.
You're like, parang they're cold and a little tingly, or how are your legs? And that's an exercise that we need to teach our kids.
Oh, that's a nice exercise.
Because the mind-body connection, so the easiest way we are aware of ourselves is through our body. Right? So you can see your toes, you can feel your toes, and just putting your mindfulness and attention towards your toes already develops your skill of self-awareness. And then you can train them into, okay, how do you feel about your experience in school? Right? Because that's a deeper self-awareness skill. But if already they don't know if they're hungry or sleepy or tired, then it's harder for them to identify sad and happy and angry and tired.
Yeah.
So yeah, I mean, I guess
Mindful.
the tip I would say is in the morning, you take a shower, or you take a shower with your kids take a shower, already do that exercise of look at your toes. What do you think about your toes?
Yeah.
How are your legs? What do you think about your legs? And you see how they feel, what they think about themselves. Oh, mommy, my toes are so ugly. I think my toes are ugly. But,
Mine
or,
too.
Mine too.
or like, oh, I don't like my legs, or I don't like how I look.
Yeah.
That in itself is self-awareness. And you can start as early as, as long as they have the words.
Very important.
Yeah. And then you can train or learn emotions and relationships, etc.
Gosh. Train them young.
You really have to train them.
Yeah. Okay, so we got a message on Instagram again. You guys can send us in any message, any concerns. We got professionals on the show. So it's the Mother Show PH. And this is from Sam Montenegro. She goes, "Hello, I'm the one who emailed about weaning. I have another question for Doctora. My 1 year and 7-month-old daughter is grinding her teeth. I haven't had her checked by a pediatric dentist yet. She also has an underbite. Is that the reason why she's grinding her teeth at night? Thank you."
Well, teeth grinding sometimes is a symptom of stress among children.
Really?
Yeah, stress or major life change. For example, the child just changed school. Your child is about to enter a different school, or anything that is a major change in the child's routine can cause these teeth grinding. Yeah, sometimes they also wet the bed. Those are because children, they're not able to express these emotions.
That's
well.
right. That's right.
Yeah, so it manifests in alternative behavior.
And this is one of them.
Yeah, even grieving in children manifests differently. Quite often they cannot say, "I miss dad." For example, a child lost her dad. "I miss dad." But sometimes you would see the baby crawling towards the door or waiting there. No?
Yeah.
That's how the child grieves. So alternative behavior like this may be a sign of a stressful experience in a child's life. But you can also have your child checked for anomalies in the bite.
Okay.
Yeah, because it can cause what do you call this? Something on the teeth. Parang
the enamel will
shave off the enamel, and then this has to be addressed. I think they put something on
a mouth guard.
Mouth guard, yeah.
While they sleep.
I teeth grind sometimes.
Also, okay.
Yeah, but it actually occurs a lot. They really correlate it with some stressful experience.
I see.
Is this the same caller who yeah, so this is the older
that's a
child,
stressful
diba?
experience.
And then it's a
Yeah.
new
There's a new
she
baby.
has a new baby.
She does?
Yeah, that was
This
the
is
first,
the
first question.
Yeah. No,
I'm not sure.
No, this is the email. Yeah, the mixed feeding
So
with the
actually,
bleeding.
yeah, it might be. Sorry, I'll just jump in.
Go ahead.
Stress nga of deciding that I don't want to breastfeed. So again, breastfeeding can be, aside from nourishment, it's a habit. It's a form of comfort for your child.
So maybe that's why she's grinding.
So it could also
yeah.
be adjustment period. That's where I would go. And again, we just have to, of course, get it professionally checked.
Yeah.
Because my husband's a grinder and there's no
Always a
stress.
good thing.
I mean, but this could be, as
okay.
Dr. Faith said, stress. So again, it's sort of observing our child and knowing our child very well. So if you're very concerned about this, it's definitely get checked.
Yeah.
If you can trace the trigger or the source, which I'm guessing now is to stop direct feeding. Yeah.
Okay.
Then
that
might
can be a
so
point
you
of
also
stress for
have
the
to
child.
give a few days for your child to sort of absorb the change. So remember, it takes 10 to 14 days for us to actually fully realize what's happening.
Yeah.
It's so funny that you mentioned that, because since they don't, and we're just to pick up off of not being able to identify what they're feeling at such a young age, they'll go into yung mga like this,
A different
teeth grinding,
behavior.
a different behavior. I noticed that because my son, when he sees me interacting with my youngest and I'm like hugging her or like I'm playing with her, he will start coming to me and he will start meowing. He will start meowing.
That's so...
And I'm like,
When
what's
did this
wrong?
start?
It's been a couple of months. And I'll try to talk to him normally and he won't talk to me. He'll just keep meowing. Meow. With his like Puss in Boots eyes, but he meow. I'm like, I'll play with you also.
Yeah,
And
just
then
trying
he'll
to
get
catch your
okay na,
attention.
Yeah. But see, it's so important, Doc Faith and Ria, what you were talking about earlier is you really have to know your child, right? And be with your child. Spend quality time with your child, because behavior like this, if you don't know about like ganito, yung mga alternate behaviors, you'll be like, what's happening to you? You're not a cat, diba?
Then you'll be upset and then cause it to snowball. As opposed to knowing what it is now. I just want more time with mom. So
Exactly.
I will give you my undivided attention now.
Yes.
But also remember to allow him to wait so you have time with your bunso.
Yeah.
So also not immediately, right?
Yeah, because he has to understand that he has to share mom.
Also,
right?
right? So
He has to share
all
mom.
these lessons all together.
Right, and that's why you breathe. Right.
Through everything.
Take it all in. Take it all in. Okay, so can you tell us a little bit about Stratum Health Partners? So the three of you who are here in the booth, Doc Faith, Ria, Bea, you're all part of this amazing team. Tell us about it.
So Stratum Health Partners, we are a group of female professionals, doctors, and allied health professionals who advocate, educate, and work towards women, the optimizing of health for women and children.
Okay.
So we approach our patients, our fellow females, not as illnesses. Okay, let's treat your illness. We treat you as a human being, an overall human being, whether it's this conversation from breastfeeding went to parenting and mindfulness and emotions and alternative behavior, and that's really what we are about. Everybody, whether you're a female, whether you're a newborn, whether you're an infant, all of these systems work together so that you can live life fully, you can optimize your health, you have healthy relationships. So on board, we have pediatrician, Dr. Faith. We also have a lactation expert, Doc Jamie.
She's a lactation consultant.
Oh, wow.
She's also a pediatrician.
She's also a pediatrician. Functional and integrative medicine. We have Dr. Candy Drilon Dalman.
Who was supposed to be here today?
Yes,
Sayang.
but her daughter had a Lingua ng Wika presentation. So that's more important than the mother
Very
show.
Gotcha.
But she's also the founder of Centro Holistico. If you've heard about Centro Holistico.
They're on their third branch.
Yeah, so they do IV nutrition, acupuncture, theta healing,
Is this
life
called
coaching.
alternative medicine? No, this is not it, right?
No, it's different.
medicine.
Integrative
Integrative medicine. Okay, copy.
And then we have a dermatologist on board.
Because
Dr.
women
Georgia
need
Chuser.
dermatologists.
Yeah, women need dermatologists, and all these hormones every month.
Skin.
Skin.
Skin is a
and-
big thing.
Exactly.
Also for kids.
Even for kids, a lot
Agree.
of these small irritations. So Ria is also with us. She's a child sleep and behavior consultant,
That's
positive parenting consultant as well. Most important also is we have a nutritionist on board. So a lot of your mental health challenges, parenting challenges, and challenges with your children are about their nutrition. So a while ago, we had a caller who said, my child is not growing in weight, and I'm eating all the carbs, but she's eating, let's say, white rice and carbs as chips and french fries and things like that. So proper nutrition is also very important for holistic health. And, of course, yoga therapy for mental health.
Yeah. So people who come to you are usually mothers?
For now, I think we have a lot of patients who are mothers, a lot of children also, newborns and infants.
Single women are also welcome.
Who are also, single women, especially those who are preparing for parenthood or motherhood or things like that.
Okay.
So we all have our clinics and our practices.
Okay.
But we all converge in Centuria Medical Makati. Yeah.
And how do they get in touch with you?
Well, you can email us at stratumhealthpartners@gmail.com. You can message us on Instagram at Stratum Health Partners.
Oh, nice.
Okay.
So send us your questions.
Health partners.
Soon enough, September, October, and November, we'll be having a series, and by series, I mean like almost every week, of workshops and talks that are multi-specialty. So it's not just a pediatrician on board in that talk. It's also
Kinda like what
kind
you
of
did
like what
here.
we're doing now.
that's-
So it's
oh.
2 or 3 of us talking about the same thing.
I love
That's
it.
nice.
Yeah, because
Look at their Facebook page. It's all there.
super cute. I love it.
Yeah, we'll share their Facebook page so you
Thank
know
you.
how to get in touch with them. But anyway, I still have a lot of questions about breastfeeding. Okay, because people moms who just gave birth and they want to start exercising. So how does that affect breast milk?
Well,
Does it
exercise-
decrease or will it increase after?
Actually, no. Depends on how strenuous the exercise is.
Okay.
No, because we don't want high cortisol levels in your body, but we know that exercise also increases endorphins. It relaxes you. It will therefore increase your milk supply.
But
So-
I also heard something funny because when I was exercising and they go like, you know what, we shouldn't stretch you so much because it's
Okay.
gonna lessen your breast milk.
I don't see how
know
that's
where
gonna
that
work.
came from. I've never heard so I was like, okay, sige, I won't stretch so much anymore. So
Bakit kaya?
I don't know.
Parang that doesn't make sense.
Exactly, right?
Yeah, I don't think that makes sense.
Yeah.
But physical activity, no matter... See, the requirement lang of physical activity for you to modify your cortisol level is literally 150 minutes a week. So that's very little. That's like 30 minutes a day, 5 times a week. And that can be walking, that can be running. So it's again a balance of how strenuous the activity is, but also how your body is. You know that when you get pregnant, you give birth, a lot of your body parts are wrecked.
Oh.
Like wrecked. Like not even kidding, wrecked, right? So it depends. Sometimes heavy lifting, for example, even heavy running, affects or puts more stress in your body. That's why your breast milk reduces, right? Versus, let's say, and I plug it in, yoga, which is less stress but still physical activity. You can modify how strenuous it is or not.
Nice. Stretching no? That's funny.
Yeah.
I've never heard of that before.
I think one of the instructors said, I won't stretch you so much because it's gonna lessen your breast milk. I was like, huh.
Interesting. 11:28.
Research that.
Magic, hello.
Hello.
Hi. Who's this?
Good morning, Mommy. Yes, this is Lot.
Hi, Lot. Welcome to the show, Lot.
Hello. I just have one question. Though, narinig ko lang. They said that it's a big no that after make love, you do breastfeeding to your baby kasi it's bad daw because you're pagod, something like that.
Okay, wait. Teka lang.
I'm not, I'm done with the breastfeeding.
Again,
Fair
any
enough.
physical activity is good for breast milk. And especially ones that heighten good, happy hormones.
Teka lang. So, after having sex, you should not breastfeed kasi it's not good for the baby.
Because?
No, is that the myth that we're working
That's
with?
the question.
Our experts?
Yes.
It's definitely a myth.
Is it true? Kasi yun yung kwento ng mga matatanda.
No, it's a myth. It's
Trying
a
to
myth.
think of why.
Yeah.
Okay.
Because
Right?
after making love, you're happy, right?
So you might have more breast milk.
Yes, that's true. You're more relaxed. You are more relaxed. You are not stressed. Then you'll be producing more milk.
Okay.
And usually, consider
So that's
the
a
time
myth.
of day.
Myth.
Yeah.
Mega myth. Mega myth.
I have a last question pala.
Go ahead.
I have experience kasi na nagkaroon ng wound yung nipples or areola because of yung sucking ng babies. Sobrang higpit talaga. So, nagsugat siya. Then, sabi ni OB, the only thing daw na makakagaling is yung saliva ni baby. So, just keep on breastfeed pa rin.
Well, depends on the extent of the wound. If it's really bleeding and cracked open,
Like laceration.
then,
ganon.
lacerated. It would be best to rest that side. Maybe you can pump milk first so it's gentler. But the saliva of baby would really keep the wound more moist. You can put breast milk around it to help it heal. But if it's severely wounded, then you let it rest first. Yeah, it's okay to let it rest. You can pump or hand express the milk from that side, and then you feed it to baby. There's nothing wrong with that.
Yeah, I did the, what do you call that, yung, kaso nung nag-pump ako, there's like blood. So, natakot ako sobra.
My blood. You clean it first. Clean your breasts first. Small amount of blood is okay.
How about lanolin? The cream?
Yeah, that you can apply that to help in improving the wound, to help it heal faster. There.
Cool. Okay, Lot.
Thank you so much.
Thanks,
you
Lot.
also.
Bye.
Thanks. 11:32 is the
Okay.
time.
I have one more.
Okay.
Go ahead, Anne.
So, well, when you drink alcohol,
like,
do you need to pump and dump? What's okay for the intake?
Ay, oo.
Diba?
Let's talk. Let's talk alcohol and coffee. Kasi those are the top two beverages that moms can't. Okay, well, top
just
two
say
favorites.
coffee.
Di naman can't live without. Okay, sige, go.
There is a limit. Yeah, I drink coffee.
On both?
Yeah,
Okay.
on both. With alcohol, I think it's 0.4. It's hard to remember. It's 0.4 milligrams per kilogram body weight, something like that.
So there's
like
body
2
weight
glasses
that
of
comes
wine.
into play.
2 glasses of wine.
Labas ng calculator.
I'll take it out. I have that.
Okay, so what is it again?
Okay.
But after you drink alcohol, it's best to breastfeed only 4 hours after. So there's enough time for the milk to clear.
But not exactly pump and dump. Or is that advisable?
You know what? There are actually strips.
I've heard of these strips. Have you heard of these strips, Andy?
Yeah, I never used them.
Yeah, to check the
okay.
alcohol
Okay.
levels. But the safest is really not to drink. The safest or to
Paano yung wine night natin tonight?
But you can so you can also breastfeed 4 hours after. If you want, you can extend it.
To be
So
safe.
you can feed your child your stored milk first, So the alcohol is metabolized in your body. It gets metabolized fast, the alcohol. Otherwise, there will be symptoms on your baby.
Let's just get sleepy. No, because according to my OB, he said that it's okay to take 2 glasses.
Yes,
and then you can just feed like whenever they're hungry.
Yeah. As is.
Yeah, as is. As long as it's like maximum is like 2.
Yeah, but the guidelines say you just feed after 4 hours, just to help it
maybe be safe. Yeah.
And drink a lot of water.
Yes.
Yeah, in between.
Okay, so that's wine. How about
just
coffee?
Don't exceed it. Don't exceed 2 cups.
So 2
a day.
Okay.
It's 200 milligrams of caffeine. Yeah, and if that's your limit, don't take any other items with caffeine as well, like soda. Or
how about cigarettes?
Cigarettes are never recommended.
Not allowed. In life, no?
Yes. Well, especially around the child, especially a very young infant, it can also increase the risk for SIDS.
Can I talk about, we brought up cigarettes, so of course that's not good, right? But something that I also just learned recently is let's say some parents think I will smoke outside of the house
and that's fine,
and I will come back in. Please note that the cigarette smoke smells
sticks to your clothes.
Sticks to clothes.
And that is not good?
Yes, and that is possible that you will carry your child and they will be on your clothes and they will smell and take all in those toxins. So it's like third-hand smoke.
That's third-hand smoke.
Oh, wow.
And I just learned that also after all of this.
Yeah, because you know of the first time when you're actually doing it and when you're around the smoke
so
itself.
But there's also
just the smell.
Yes, and the residual on your clothes can affect.
Yeah, I tell my patients, if daddy is really addicted to smoking, he has to smoke outside the house, sa kanto. When he gets back, take a bath.
Wash clothes.
Wash your hand, wash yourself.
Is this a late discovery? Was just discovered, or has it been around?
There's robust evidence about cigarette smoking already. So it has already been proven to cause health problems both in adults and children. So there's first-hand smoking, second-hand and third-hand smoking. And second and third-hand smoking can still lead to cancer, to different kinds of cancer.
So quit smoking, guys.
Okay,
not good
and then
for
when
you.
it comes to like, because we're allowed to drink wine, but when it comes to like tequila or gin,
Ikaw, alam mo,
no, this is just
question ni Andi.
When it comes to other forms of alcohol, which
but that's when you
also-
pump and dump, right?
Yeah.
Okay.
Yes, you can pump and dump.
I'm just going through the questions
And then
and the myths.
Maybe if you're really into drinking,
Yeah.
limit your intake, the volume at least. So
Okay.
you get to taste it, but you limit the volume. And then if you're into social drinking, you get those strips that will tell you if there's still alcohol in the milk.
Okay. And then it says here, somebody goes like, is it true that when you exercise, your milk will turn sour?
Haven't tried.
Yeah, we haven't
But
tried
when I had milk tea,
and then drinking our own milk.
My son said, "It's sweet, Mom.
It's so sweet. Taste the boba.
This is exercising. Baka because may sweat.
Baka your own sweat. Clean first
Maybe
your
take
breath.
a bath first after you exercise.
Clean first your breath and your nipples.
Alat, mama. Okay. So because we mentioned Star Milk, I just finished my breastfeeding journey with my youngest. And lately, it's so funny because after 2 weeks of not breastfeeding, she all of a sudden just pulled my shirt down. And so I was like, sige nga. And she did that for like...
And you still had milk?
Yeah. Like I'll express in the showers. Meron pa. And so I tasted it. I
Is
did.
it sour?
It tasted a little bit sour. So my question is, anatomically, like, is this what happens to breast milk when you don't feed anymore? Does it turn, mapapanis ba siya?
Not really, because it's it's
wrong
inside
with
your
my
body.
What's wrong with my body? No, because I was having the same conversation with another mom who just also ended, and she's like, it's so funny because I still have milk.
Okay.
But it doesn't taste like the
Breast
milk of
milk,
before.
yeah.
Yeah, it doesn't taste like breast milk anymore.
So she tasted
She
it.
tasted it also.
All right.
And she gave it to her older daughter she's 7.
Okay.
And she was like, Mommy, parang it's panis. Yeah, ganon. So I wanted to, if it's stored there for a long time, does it turn sour?
It probably change in terms of its taste and quality, since it's stale milk already stored inside your breast.
Is it still healthy though? Is it still okay for consumption?
Yeah, it is.
Okay.
It's still milk. It's inside you.
There's no such thing.
Yes.
Okay.
So it will still flow out of your body as long as it's inside you. So it's in the right temperature, no? Instead of
right temperature.
Yeah. It's
good to know.
It's in your body, so it's still good.
So as long as you have milk, it's still okay for.
So there's no guideline telling us that if you stop breastfeeding and there's still milk, don't give it to your baby.
Okay.
Yeah. So it's still milk. It's still food.
Because I was wondering, because she seemed to latch on fine, and I could feel her sucking, and I was like, oh, that's funny. Meron pa pala after like how many weeks of not?
My son did the same nga.
Talaga?
Yeah.
They do that, no? So it's
I was able to wean him already, but when he got sick, he went back. Sorry, Ria. Consistency.
Yeah, but I also go back with, you do what's comfortable for you. You are the mom, right? So if you want to breastfeed for an extended period of time, go for it. Because if you feel like someone is forcing you to stop, right, then you don't do it properly, and then there's stress and all of this. So it's when you're ready and when you feel like your child is ready.
I see. That's okay.
Yeah.
That's
So we're here to provide support when you're ready. I'm not here to tell you there is a time or what to do
when you're ready.
Yeah,
I love that. It's 11:40 on the clock. Can you imagine? It went by so fast.
Yeah.
I feel like we've just been talking for an hour. But 6310899. Any last minute questions that you might want to ask our professionals? Just let us know. Magic, hello. Are you still there? Magic, hello.
Oh no,
we lost
him.
It's totally fine. So again, where can they find you? Stratum Health Partners.
Yeah, it's in 1532 Centuria Medical Makati. And it's right across Century City.
And then you can email us at stratumhealthpartners@gmail.com or send us a message on Instagram at Stratum Health Partners.
Okay.
Someone's asking, and they don't want to just be named. They go like, how do I know if my baby is getting enough milk?
That's a common question. Yeah. But the indicator of getting enough milk is always in the number of times that your baby pees.
Okay.
Or poops. Yeah. So the number depends on the age of your child. So, for example, if your child is no longer a newborn, then you would expect 6 to 8 diaper changes in a day. And that would soak the diaper adequately. So if there is a change in the volume, the perceived volume, the weight of the diaper, or the frequency of peeing or pooping, there may be a decrease in supply. So what do you do? How do you increase the supply? You breastfeed more frequently. That's the only thing. You just increase the frequency of breastfeeding. You correct the other factors, mechanical factors. If you are, for example, supplementing with a bottle, then check your schedule if you are stimulating your breasts regularly. Then that's how you can maintain or increase the supply of your milk.
And then follow up to that, what you pump out, is that a direct indication of how much milk you have?
Oh, that's another myth.
Yeah,
that's another myth.
because sometimes when you pump, you get so depressed that it's just like so little.
Yeah, as I said a while ago, infants are more efficient in extracting milk. The milk that you get from your breasts through a pump is not an accurate indicator. No, so never count the volume coming out from the pump because there's always something left there. It's not the most efficient gadget to extract. It's always your baby who can extract everything. So even after you pump, you let it rest, and then there's more milk coming out. No? So sometimes while you're pumping and you think there's no more milk coming out, you can rest first and then do another cycle of expression. And then there will be another session, another cycle of milk expression.
It's good to know, right? Yeah, because you're right. A lot of moms, they'll base that on, 1 ounce lang.
Yeah, I told you it all depends on confidence. If you lose that confidence, all the more you will decrease your supply. So empower yourself with knowledge.
Yeah.
Know these things that the pump will not tell you how much milk you have. It's not like a thermos. No. So whatever you pour out, wala nang natira. Ganon.
Yeah.
No?
Yeah.
So the stimulus is always emptying the breast. If the breast is completely empty, your body will make more milk. Yeah.
Yep. That's it. That's the fad. That's the whole process of the body and how it makes milk. Galing.
Yes.
Somebody tweeted us, thanks for the advice. Kasi sasabihan lang ng pedia na pakainan ng ganito, but now may idea na ako on how to do it in terms of, the feeding and how to be less picky. And
Galing. And somebody also mentioned, is it true that formula-fed babies sleep better and sleep longer compared to breastfeeding babies?
Actually, no. Breastfed babies sleep better. You know why?
Really?
The breast milk is composed of more whey, which is whey and casein is present in milk, right? So formula-fed babies, they get more casein. The thing is, milk, human milk is very human-specific. That's why the whey content there is more easily digested. So babies who are fed with formula milk, they tend to be more colicky. They tend to have more gas because the milk proteins that they receive are too big for them to digest. So a lot of parents, they end up upgrading their milk to those that are more hydrolyzed, more finer than the usual cow's milk, and with more whey, all those additives, only because the child cannot take it. And they cannot sleep well because of it. They are more irritable, and you have to burp them for longer.
Okay. Yeah. So, because you mentioned human-specific.
Yeah.
Does that mean cow's milk is more cow-specific?
Of course. Yes.
And because, I had this notion years back, even before I became a mom, that we are the only species who drinks other species' milk. And that was such an eye-opener for me because I grew up on cow's milk. Oh, I loved cow's milk, right? And then I thought about it, like, if you drink cow's milk, that means that the nutrients that you're getting are technically for baby cows.
That's true. That's true.
Right?
That's true.
Therefore,
that's why the best milk for humans
is breast milk.
Human
right?
milk.
Yeah.
So you should
And that's why there are also studies now that say, cow's milk, because of the fat content, causes a lot of problems in your digestive system.
In the long run,
in the
right?
long run.
In the long run.
And it's just faster for children and infants and newborns because they can digest their food faster.
Yeah.
For us, the symptoms are longer because we already have a lot of things in our body.
System. That's right. Right? So that was like...
So then I asked
milk.
Yeah, different kinds of milk, basically. Okay, last call before we wrap up the show. Magic, hello.
Oh yeah, hello.
Hi. Welcome to the show.
Hi,
Who's this?
Good morning.
Good morning.
Is this still about breast milk topic?
You bet it is.
Okay. So I work in a pharmaceutical company, and I have a friend, and I'm curious about the DHA content of some milk.
Okay.
So I'm still breastfeeding my 4-year-old toddler at night.
Good job.
But still, I would like to give her supplements for brain enhancement, etc. So a friend told me na those milk doesn't really would help in improving the intelligence of the kid.
Yes,
Those
yes.
who claim
DHA is important.
Higher DHA.
Correct. Yes. DHA is really important. And you probably didn't know that the gold standard for formula milk, infant formula, the main thing that they're trying to copy here are the components of breast milk. So the breast milk really has the perfect proportion of all nutrients, including the DHA. So,
so it's still better for me to let my child latch on me whenever she wants to.
And
yes,
food,
how old is your
Yeah.
child?
4 years old na.
4?
Yeah.
Ah, your
Yes.
child is 4. So, okay,
But
so
a
it's
lot- I
extended
still have a
breastfeeding.
little milk na lang rin.
Okay, so in reality, for a 4-year-old, your child has to be eating more than drinking milk.
Alright, I
Yes,
know.
extended breastfeeding is okay. Yeah, it's still food, but it can no longer sustain your child's nutritional needs.
The nutritional value
Yes.
doesn't really lessen, but she needs more of that.
Yes, and
Alright.
she needs to be eating more food at this
Okay.
point. Yes.
That's all. Thank you very much.
Okay.
Thank you.
Okay, thanks.
Thanks. Bye. 4 years old. 4 years old. Wow. It's 11:49. That's what you're shooting for, diba? 4 or 5, like Tita Rose. 4 or 5 years old. It's 11:49 again. Thank you so much, Doc Faith, to Ria, to Bea,
You're welcome.
for all being here today.
So much fun.
Wow.
Again, they're from Stratum Health Partners. They're a team of 7 professionals. They will cater to moms and babies and anybody else who needs help. If you want to experience, it says here on their flyer, experience our team-based primary care and wellness services. So that's where you can find all of it. Again, Stratum Health Partners. You can look them up on Instagram. Or you can book an assessment through stratumhealthpartners@gmail.com. Thank you so much for being
Yes,
here.
thank you so much. You know,
Thank you so much.
we are still getting a lot of messages
I know.
about like different topics
Okay.
for you guys.
I know.
So if you want, we'll just connect you guys
Alright.
with these doctors, and we'll also post their account on our Facebook page. So at
Yes.
least it's easier
We'll
to
share
access.
it.
Yeah.
We'll share it.
The show for moms by moms. The Mother Show on Magic 89.9.